I started psychiatry in 1966, and quite early on in my training I worked with older people and eventually became a specialist registrar, or senior registrar as it was then called, in old age psychiatry. And I was actually the first old age psychiatrist appointed in Leeds. When you come to a rural setting like Craven, getting people together is actually quite difficult. We actually have a tele-buddies system so that people can communicate by phone and support one another on the telephone. We have local smaller groups that meet for sort of tea or lunch, and this would be carers and people with dementia meeting together with somebody there to help them. These sort of developments, which are much more locally based, you can't stereotype what's going to be needed. And not all cities will be like Leeds, not all rural areas will be like the area of North Yorkshire that Craven covers. Services that were provided must be person-centred, but that meant by definition that they must be flexible. And the trouble is that people can talk about needs-led, can talk about person-centred care, but when it comes to the nitty-gritty, the kind of responses are so stereotyped. And I've always been aware that some people like going to luncheon clubs or day centres and these sort of communal activities. Some people do not. Everyone's not the same. And what you can go on doing depends on what your abilities are, the bits of you that are not damaged, but also the kind of person you are. So it should always be an individual thing. And I'm lucky that at the moment I'm able. Most people don't realise that I'm any different, really. The thing that happened for me was that the changes, although my memory wasn't as good, it wasn't so different that it couldn't have been part of normal ageing, although I'm relatively young for that. But I noticed other changes. I've always led a very busy life, have a large family. I'm a wife of a clergyman, so I'm involved in his work, as well as my own work and the voluntary work that I do. So multitasking is certainly something that I normally am used to doing. And I really noticed that was getting more difficult. That means that when I get under pressure, I actually find it much more difficult, and I get stressed and upset when I'm interrupted, when I'm trying to do something, and also if something is complex, I have to be very focused and concentrate very hard. I can't sort of do it in the midst of other things. I also noticed that my visual memory, something had happened to that, particularly finding my way to places. Before, if I'd been to somewhere once, I could always find my way back there. But suddenly that wasn't happening anymore. And the other thing is I started having difficulty finding words. My husband said it's one of the things he particularly noticed, that I more often couldn't find my way back to where I'd been in the conversation. And sometimes I'd just stop and got lost. I just went blank and couldn't think what I was actually talking about at all. And again, that was something completely different. And I'd also started having to look at recipes, which for things I normally cook without thinking about. And I'd actually had difficulty with mental arithmetic. So I knew something had happened to me. I'd been very stressed on things that were quite different. But I didn't seem to cope with that stress, and I actually became depressed. And I had some help with the depression, but once the depression was relieved, all the other things were obviously still there. And so I knew something had happened. And I actually have very, very early vascular dementia, which most people probably wouldn't have diagnosed as early, but it's there. The changes are on my CT scan. Being given that sort of diagnosis involves a bereavement. It involves a loss, and therefore one looks at the rest of your life differently once you have that diagnosis. And some decisions are easier because you know where you are, but also it's all the more important to make sure that you do things the things that you want, that you feel you can do now, that you've always wanted to do, and that you do them. The things for me are not particularly complex things. They're not flying off the other side of the world. They're relatively simple and straightforward things. But it's more important for me, in a sense, to look after myself psychologically.
Tell me about it.
I mean, I'm very lucky in that I can still do a lot of things that I've done, and in spite of the fact that people know my diagnosis, I'm still asked to do some of the lectures that I've done. No one says, do you think you should be not working anymore, and this sort of thing, and I think that's very important, because that's another thing that people assume, that you have a diagnosis of dementia, then you can't do things. And I always used to tell my patients they must tell people that, like the DVLA, didn't mean they had to stop driving. No, I practice what I preach. At the moment anyway, I've nothing to say I'm not going to develop Alzheimer's disease, but it makes it easier that at the moment that's not the diagnosis, because people don't have all the preconceptions. Alzheimer's disease has been known long enough for people to have a very bleak view of it. And I think that the trouble is it's been known, but only known really in the late stages in the past. And that's why there's a lot of education to go on about early stage of dementia, because it is a very different thing. But people's idea of Alzheimer's disease has always been the end, and that's how they see it. And I hope that gradually people will learn that it isn't. That isn't the whole story.